Wellness Wednesday is brought to you by Enfagrow, nutrition tailored for toddlers.
Welcome back to Trinidad and Tobago. Hema, Ramkissoon, and Professor Christopher and Dr. Chandra Degia joins us on set, but I hope I got the pronunciation correctly. Good. We're talking a little bit about our Wellness Wednesday, and it's One Health, One Caribbean, One Love project. It was implemented under the auspices of the University of the West Indies, and it's about partnering with everyone that you can partner with, because they were trying to explain it to me somewhere. Like, what does this mean? Pretty catchy for health. Good morning. Thank you for joining us.
Good morning.
Thank you for having us.
Professor, we're talking One Health, One Caribbean, One Love.
Yes.
That's a pretty snazzy title for a health campaign.
Yes, it is, but it's what One Health is all about. It's all about love. It's all about working together. Because at the moment, what we have is we have people working in their silos, people working in their individual disciplines. So we have our medics doing medical things, we have our doctors, our veterinary surgeons doing veterinary animal things, we have our environmentalists doing environmental things. And so many of the key health problems that we're facing in the world and in the Caribbean need an interdisciplinary approach, because they're affected by the environment, human health, and animal health. And if you don't look at it from this multidisciplinary way, look at these problems, you're really not going to be able to address them. So One Health is all about bringing these people together from the different disciplines. What we say is de-siloing, getting them out of their comfort zones, getting them round the table so they're all working together to address some of these really important health issues that we're facing in the Caribbean and in the world.
So you talk about removing silos. We can't even remove a silo in an organization. You want to get the regional health institutions involved? How are we going to do this?
Well, the One Health project, the One Health Caribbean project, really under Professor Oura has really brought us together from different disciplines. We have environmental scientists, we have public health persons, we have veterinarians, and from all across the Caribbean we work together. And under this project, where there's a leadership series, which I am a part of. I'm from Jamaica. And we work together. So on my team, I have 2 veterinarians, a public health person, I'm an environmental scientist, and we work together to actually address a complex problem in Jamaica. The problem that we're looking at is really looking at the issue of water drought. There's persons having conflict over water in their community. We all work together. We've never worked together before. So the challenge is working together. The vets bring their strengths in terms of animal husbandry, how we're going to work with the farmers and their pig waste getting into the river, contaminating the river. Myself as an environmental scientist, I address some of those issues. We have had workshops with the community. The public health officer does the water testing. So we all work together to address and help the communities to solve their problems.
This is about having a workshop as well, in terms of, and I see that you are looking at antimicrobial resistance, climate change, habitat destruction, biodiversity loss, food security, water issues. I don't even know where to stop. But the workshop itself, are you taking on more than you can handle?
We are very aware there are a lot of health issues out there that need to be addressed. So we are prioritizing and focusing on some of the key issues. And the first one you mentioned, antimicrobial resistance, is one of the key areas that we're looking into to follow a One Health approach to address it. I mean, many of the viewers will know that we're getting antibiotics now. We have less and less antibiotics available now because we have resistance to these antibiotics appearing. And this is not only a problem for human and with people dispensing antibiotics in poor ways, but it's also a problem in animals, because people are feeding animals antibiotics as growth promoters. And it's also a problem in the environment as well, because antimicrobial resistance can be transmitted through environmental areas. So this is a perfect example, and there's a really big United Nations push at the moment for all countries of the world to address antimicrobial resistance. Otherwise, we're going to end up in a pre-antibiotic era when people are dying of diseases with no antibiotics at all to cure them. So this is a major problem that needs to be addressed by a One Health approach.
Have you reached for the stage of policy formulation?
Yes,
Yes.
we do have a One Health policy in place in the Caribbean. The Caribbean is leading in this area. So the Caribbean One Health policy has been accepted in the key environmental, human health and animal health CARICOM institutes. So we have a One Health policy in place, and this workshop that we're actually doing today and yesterday is all about plotting a way forward. How we're going to work with this, how we're going to push this One Health policy forward into action and for it to be implemented.
As we wrap this interview, it's about the workshop and getting the region to move forward with this. What is the end goal of this? Total eradication?
I don't know if we'll ever totally eradicate disease, but the aim is really to address these issues in a way that minimizes how we use resources. So instead of everybody using different resources, the same, we can all utilize the same resource in a better way so that we can maximize how we use the limited resources we have available to us in the Caribbean.
The closing comments there. We take a short break. When we come back, we'll have more for you. Stay with us. This is The Morning where we tell you a little bit about Oktoberfest.
Wellness Wednesday was brought to you by Enfagrow, nutrition tailored for toddlers.